And I'm going to start recording before I forget to do that. Um, Welcome, everybody. Thanks for coming to our workshop series, whether this is the first one you're joining or you've been here for all three. I really appreciate just having folks come in and here to learn about this very complicated but very fascinating topic. So this is our third final workshop. We're talking about communicating data, and I'm personally super excited to hear all of these presentations ranging from visualization to communicating different aspects of kind of complicated data. Then before we get started, just a couple of housekeeping things. We are recording, as you just saw, I started that a little bit ago. So if you don't want to appear in the recording, you can turn off your video. Also, please keep yourself on mute unless you're asking a question or something. And then you can send your questions in the chat. Our structure is probably going to just be presentations and then a big Q&A at the end. But if you have any burning questions that you want to put in the chat during the sessions or during the presentations, maybe we can try to answer them directly in there, or reserve them for later, whatever works. We can definitely be flexible about that. And then the last thing is, since this workshop series was funded by the National Association of Science Writers, I'm kind of borrowing their rules and code of conduct for these sessions, which I'll put the link in the chat here. The TLDR is really just to be respectful, as you would at any Zoom webinar or any in-person meeting once maybe someday we have those again. And so to get started with our talks, the first one is Anne and Will from the city. I'm personally super excited for this because I've been following this publication through the pandemic. I've relied on their dashboards a lot. And also just for the sake of full journalistic disclosure, I as a private person donate to the city. So I just wanted to that doesn't have anything to do with the workshops, but I felt like I should disclose it. Anyway, so Anne and Will, you can get started.
Oh, thank you, Betsy. Hi, my name is Anne. I am a senior data reporter with the city. I'm very excited to present what we've learned covering the pandemic the last year. Before I start, I have to say I am on my phone hotspot. That is my last resort in terms of my bad internet connection. So I'll do my best to keep this short and brief so I can get through my slides. But if my internet cuts off, you will have Will to pick up where left off. With that said, I'm going to share a little bit about really different ways we have communicated COVID data. And since we are a local news publication, a lot of this, all our stories focused on New York City, but some of the lessons we've learned, I hope it can translate to your profession, whether you're a local reporter or a bigger group, or just simply a community member trying to keep folks informed or try to tell a human interest story. I hope you take away with some of the points that you find useful. So Betsy, could you go to the next slide? Am I having, oh, there you go. Okay. Okay, so preparing for this workshop, I went back and looked at our first coverage when this was all starting. And, it's part of the lesson. We didn't know better. I think that would be one way to describe our coverage. I think we were focusing on the immediate impact in local businesses, just a lot of uncertainty among private citizens, what to do. We were also paying attention to what the government agency were starting to do, and especially for city government. And I think now looking back, I think we did a fairly good job of documenting just how little coordination there was. One example that I showed up on the screen was, although city agencies, different departments were collecting information on whether their workers were getting sick, there weren't really establishing a centralized place for collecting data or information, and along that point, disseminating any sort of guideline. And I think that sort of lack of organization really had a, I mean, deadly impact on how the pandemic played out in New York City. If you can go to the next slide. Now, a year later, we have done hundreds and hundreds of coronavirus story. As you know, it has touched every aspect. It's not just a health story, it's an economic story, it's a transportation story. I mean, it really changed the course of how New Yorkers live. And the two projects that I really want to highlight is one, really it's a memorial of all the information that we can get in terms of New Yorkers who have lost lives. And I think it's pretty impressive that as of today, I think about they've collected obituaries of about 9% of those who have died of COVID. I don't know of any other coordinated effort of documenting those lives that we've lost. So I hope you can take a look at the project, because I think it really drives the point that you know, we can get accustomed to reading about people dying, about the tremendous number of people death in terms of in the city or state or nationwide, but being able to humanize those people and their lives and how people remember them, I think it's a great public service. Another piece of reporting that I'm very proud of, and will elaborate further, is our tracker. Like Betsy said, and I'm very happy to hear that you've been using this. You know, we wanted to provide a place where people can really get the essential information on a daily basis of what was happening. And I will leave that to Will later to expand on the project. Next slide, please. Okay, so one thing personally that I try to convey in my reporting of the virus or the pandemic is that, you know, a lot of it, as devastating as it is, and as, you know, in a sense, we've grown accustomed to how it changed our lives, I think a lot of the fatalities, a lot of the cases could have been prevented, right? There are components of how the city government, how the state, how the federal government handled the interventions that really could have made a difference in human lives. And one example that I like to really bring up a lot is, as you can see, just the examples of two cities, right? And I have family members still living in Seoul, so it's an example that I, you know, think of quite often. Seoul is just as densely populated, actually twice as more populated at densely populated at New York City. It has the same number, if not more number, of subway lines. They had very similar socioeconomic factors, but when it comes to fatalities number, I mean, you know, it's I think it drives the point that things didn't have to get as bad as it did in New York City. So in a way to highlight how different measures, preventive measures, could have made a difference. One example that I used to illustrate this point is by looking at, could you go to the next slide? By looking at two similar neighborhoods in terms of its socioeconomic status, but had very divergent COVID outcomes. And for New York City, this was one tragically named neighborhood, Corona, and another named Flushing. Those are these two neighborhoods are not only geographically close to each other, but also they were very similar in terms of the number of foreign-born population, the proportion of essential workers, the household density. On paper, they should have had very similar COVID outcomes. Could you go to the next slide? right, those are the indicators that I looked at to sort of pick the neighborhoods that that would be a good example. So socioeconomically very similar, but because Flushing is primarily made of East Asian New Yorkers, a lot of Chinese and Korean American residents, they were able to really use information they were hearing from back home in a sense, and took measures into their hands and really did things that the city government wasn't asking them to do, but I think, in my opinion, made a huge difference. One thing they did was Flushing residents didn't have to be asked to wear masks, right? They voluntarily wore them a lot. You know, there was no pushbacks in terms of the questioning the effectiveness of it, or the questioning the liberty aspect of it. Another critical action they took as a community is that a lot of grocery workers, they demanded that they demanded better, safer working environment. But when the owners weren't able to deliver that, they said, you know what, we're not going in. What you're providing us isn't enough. I understand that business has to be open, but this disease is way too serious, so we're not gonna go in to work unless some measures are met. And this was way before there was any sort of shutdown order by city or state. So because they took these preventive measures, it really showed up in the numbers that even though they are similarly poor, similarly vulnerable population, they really had fewer number of cases and deaths. So when you are looking at your locality, I would encourage, you know, we've heard from different data set after data set tell us that the fatality and cases, it's closely correlated with socioeconomic status of a neighborhood. But if you can find those that are comparable but had different outcomes, I think it will give you a good chance to explore what action they took made a difference. Next slide, please. And in trying to assess different socioeconomic traits, these are the two resources that I use a lot. If you are more comfortable with coding, maybe you're already familiar, but Tidy Census is the R package that I highly recommend using to easily access and download Census Bureau data. But also censusreporter.org is a very friendly, user-friendly interface, which I think is actually much better than the new one that the US Census Bureau put out. I can't recommend it enough that there are tutorials to how to use it, but you will find it pretty intuitive to use. So that is one resource that you can use. Next slide, please. Right. I'm just going to walk through some of the ways that we communicated the COVID data and the impact on the communities. One story we did when the vaccination effort or campaign started to roll out, we noticed that the New York City wasn't really doing its job vaccinating its residents. One way we showed that was, okay, if New York City was a state, it would rank maybe, I think, the lower bottom out of the states. We were trying to illustrate that we weren't doing a good job. But one other way to really drive home that point of the cost of not not running an efficient campaign would be that it's missing out on the number of vaccinated people. So, you know, it's a simple math. It's just calculating how many more people it would have been vaccinated had New York City had a better rate. But I think spelling out the estimated number of what a better policy would have brought on, I think that's an effective way to showcase. Yes, it's a bad, having a bad policy is bad for the city in terms of reputation, but there is real cost attached when it comes to the pandemic. Next slide, please. Right. Another example of our coronavirus reporting. Numbers are effective in terms of getting a snapshot or context of what's happening on the ground. And this story, Will and our reporter Ruvain, when the more detailed vaccination data came out, Will saw that outsiders, people who don't live in New York City but work in New York City, were getting a good amount of vaccinations in city sites, right? Sites that are operated within the city. So this was a story that we reported on. So people understood, or there was data available to paint this picture, but what really drove policy changes is when we were actually when there was an actual place or actual center attached to this disparity that illustrated that disparity in real life. If you go to the next slide. Right, this story, our reporter Josefa, she went to a vaccination site in Manhattan, and it's one of the favorite things. I'm a big fan of her, but what she did was she went to the vaccination site, and if you can go to the next slide. She did a very old school data reporting where she did a sample. She took a sample, right? She talked to 12 people who were waiting in line, and she saw that 10 out of 12 were all suburbanites, and those were people working from home. And this was the site that was meant to, touted by the governor. This was the site because it was located in a predominantly Hispanic neighborhood. This was the place that would bridge the gap. But she went there, showed up, and talked to people, and in very simple terms, illustrated that that wasn't the case. If you can go to the next slide. So after her reporting, both city and the state made policy changes that issued the vaccination sites operated in the city should vaccinate city residents first. And I want to stress, I think it's important to focus on accountability in terms of who's getting vaccinated first, only because numbers after numbers show, again, just the devastating impact and also a devastatingly unequal impact on certain communities, right? It's had, say, suburbanites or predominantly white neighborhoods, if we knew the virus had affected those communities more, I think, of course, it makes sense to prioritize them. But when we knew from 12 months of living through this and gathering data, we knew where the weak, vulnerable population lived, and the fact that city and state did not prioritize the communities who are still at risk. I think that that was the point that we wanted to highlight. And again, writing about numbers and highlighting the disparity, that's one way, but really showing that in action through street reporting, I think is another effective way to illustrate that. Oh, so now this is another way New York City is displaying who's getting vaccinated. It's simple, it's straightforward, but I still think reporters or experts can communicate government data in a more meaningful way. If you can go to the next slide. What we did for our story was, yes, one way to look at who's getting vaccinated is simply showing the proportion by different age group, but we wanted to stress, okay, among the eligible, what is the gap, right? people may not immediately know which racial group or which age group residents there are more in your locality. So calculating the rate of who's getting vaccinated among who's eligible, that shows, again, a gap in a more straightforward way. If you can go to the next slide. And another way to illustrate this point is, like I mentioned before, really just highlighting the inequity between who the virus hurt the most versus who's getting the resource to be protected from it. I think now, because of the collective effort of reporters, not just us, but in local media, and also advocacy group, I think there is more pressure in terms of demanding more granular data, and community leaders and policymakers trying to remedy the gaps that's shown on the data set. So, the more we talk about it and the more we illustrate it in different ways that really highlight the human cost of this disparities, I think there's a better chance of policymakers amending that. So that is some of the ways that we're trying to contribute. If you can go to the next slide. And one way also to illustrate not only the toll of the pandemic, but also the community's effort to fight against it. Really, I think the fancy term is solution journalism, but really in our reporting, we try to highlight and display communities that are putting in the effort. And lucky for us, when ordinary people do extraordinary things like helping out their neighbors, getting connected with the city hospital, to call the seniors and make appointments for them instead of the other way around, their effort also shows up in numbers. If you can go to the next slide. Allerton in the Bronx was one such neighborhood. When the city released vaccination rates by zip code, I think a lot of us first, and rightly so, focused on the geographical gap. But what I wanted to showcase was, when you do certain things, it can make a difference. And like I said, Allerton, despite being a heavily minority neighborhood and having one of the highest fatalities, and definitely in the Bronx and also citywide, they were having a higher rate of vaccinations, their residents, certainly among similarly Black and Hispanic neighborhoods. So look out for areas that are not performing better than expected, and talk to stakeholders there and see what they're doing differently. And by writing about their efforts, by writing about their success case, the goal is that other community members, other interest groups could emulate their strategy and make a difference. Next slide, please. Final point, I really hope we don't have another type of this type of pandemic ever again, because I can't think of this large of a scale public health crisis hitting us again. Behind every number, behind every fatality, and even every case, there is a vulnerable person whose life was really wrecked and cut short. I think sometimes for no good reason, for simply us not having our shit together, for being stubborn about, you know, something as simple as not wearing masks or not staying at home. So the more we stay vigilant and the more we stay consistent and follow up on vulnerable population and how it affected our city, my hope is that when hopefully isn't another one, but if there is another tragedy like this, we would be better prepared, and hopefully that we won't have to have another type of project where we are counting thousands and thousands of New Yorkers whose lives were cut short. Next slide, please. All right, yeah, so yeah, these projects, you know, by staying on people who have died, you know, we're doing more accountability reporting. Like we're writing about nursing homes who gave out experimental treatments without telling their family members. I imagine a similar type of incompetency was repeated for different vulnerable populations. You know, we at the city are continue to report on these groups, report on these institutions, so that again we hopefully learn a lot from this, and we won't repeat any of the same mistakes we have made. Thank you.
Okay, so I think this is where I step in for the next set of slides. So I'm Will, and I'm the interactives and graphics producer at the city. And the projects I mostly work on related to COVID are our tracker page and the Missing Them project, which Anne was just talking about. And so these are the two sort of big static interactives or standing pages that we've been working on throughout the past year. And I'm mostly going to focus on the tracker here. And I guess I would just start by saying that we're one tracker of many different projects, similar projects that are out there right now. But I'm hoping to sort of explain sort of the arc of how our tracker has evolved over time, and the choices we made, and sort of how that resulted in what we have now. And maybe some of those experiences resonate. Maybe you've dealt with some similar issues, and so I just wanted to sort of highlight how we went through those steps. And so this is a pretty brief overview of what the tracker looks like. And you can stay on the last slide. Just just to give some context here about what we have on here. It starts with an overview for the city, state, and then country. You know, the top level stats for each. We have a zip code map, and then we have several charts that track different stats over time. And this is something we update on a daily basis. Anne and I are both switch off responsibility with scraping this data, doing any sort of hand copying of data that needs to happen, checking that nothing broke, and then publishing that. And so, yeah, next slide, please. And this is the very first iteration of what this page looked like. So you can sort of see, you know, the humble beginnings of where we started here. And you might notice that it looks a lot like the PDF on the right, or sorry, on the left. And I note that the charts on the bottom are different charts, even though they look similar. One is of cumulative cases, the other is of cases and tests. But our very first iterations of this tracker were really just attempts to take the New York City health data that was being published and make it available in a more accessible format. In the early days, I think starting March 17th, we were getting this data via emails from City Hall, and this eventually became PDFs in this format. And I don't think there was really a dashboard at that point that was published by the city where you could get this data. So it really felt incumbent on us to make this available. We were using it for reporting, and we really wanted to get this out in front of the people who were reading us and you know, using it to understand what was going on. In addition to the city data, we added data from Johns Hopkins and data from the COVID tracking project, which we all love here at the city. And we use them for testing and the sort of state and US level data. And that was sort of our initial package here, was a way that you could get a really quick at a glance view of what the numbers are and sort of how they've changed over time. And yeah, the initial motivation again was just filling that void. Part of all that was also because we were hand copying some of this data, was publishing this to our GitHub account, where we also published some stuff that we were hand copying for hospitalization data. And that was really the scope of this initial project, is making it public. And I think that really started to shift in May when the city started publishing its numbers to its own GitHub account in a lot more detail. I don't think raw numbers had been published to the city's GitHub page before. And so in May, when they started doing that, that's when we really focused on evolving this beyond that sort of accessibility angle. But I'll start with sort of the first major issue that we faced. Next slide, please. And that was working with the deaths data. This was sort of the first situation where we had our established tracker. After it launched, we had this new data available from the city that was not only deaths that were a result of that were directly attributed to someone with a positive COVID-19 test, but people who had COVID-19 as the reason for death on their death certificate. And this was really great data to have. I think New York City was one of the first places to start reporting this. And I think a lot of the characteristics of this data are really represent the sort of range of challenges of dealing with COVID-19 data. And in particular here, you'll see that our chart of the probable deaths has a lot of negative numbers in it. And this is because we were initially getting a lot of our daily numbers by taking changes in the cumulative data and presenting those as a way to show that change. But by the very nature of probable deaths, they were being recategorized as confirmed deaths. And so we would have a lot of days with negative numbers, and this presentation ended up being kind of a lot and pretty confusing. So, and it's probably worth noting too that the issue with getting the changes in that cumulative number also applied to confirmed deaths a little bit later on. But yeah, we were getting a lot of inconsistency in that number while we were working with it. So the solution to this ended up being that the city started publishing time series data on deaths. If you can go to the next slide. And so this is the data that we have now, and it's much more simple, and it's really based off of what the Department of Health is publishing. But I think switching from that previous view to this view is an example of where we really leaned hard into not adding complexity where it wasn't absolutely necessary. And I think there's an approach that we could have taken to this as as was shown in the last slide, where we really digged into the specific variables and the complexities that this data represents. But I think what we've tried to do is really focus on what's going to show a long-term arc of the pandemic, and where you can look at the past data, the charts over time, and see where things have changed. And I think that really necessitates an approach that is focusing on those really telling numbers. And I think there's definitely a place for digging into that data quite a bit. And I think Gothamist has a really great tracker that goes into a lot of the complexities of, what's the difference between PCR testing and antibody testing, what are the demographic breakdowns and so forth. But again, our sort of goal here is to show a really robust and focused view that'll give you some really immediate information. There are some trade-offs, I think, as in focusing down to this level, and in using the time series data in particular. You can see that we have some incomplete data at the end of the curve here, and it takes time to get new data for deaths, and this data is reported by date of death. So the most recent few days are never going to have a full count. So we traded some sort of sense of immediacy and current accuracy for a better historical view. but we sort of justified this for the deaths data in that it's really a lagging indicator, and that historical aspect felt more important to show here. Next slide, please. But as a consequence of that, I think there were some folks who had some trouble interpreting that data. I think when you pare things down, you really have to understand the data you're working with. And so we had a couple news organizations publish some reports that as we got into the summer, when there were fewer than 10 deaths reported a day, we had some days reported out with 0 deaths initially that were later adjusted upward. And I think New York Post in particular had 2 articles on 2 separate days announcing the first day with no deaths in the city, which wasn't the case. And I think the mayor actually ended up promoting one of these articles during his press briefing and announcing like we had this day with no deaths. But those case numbers ended up going up after the fact. And I think the work that we did on the tracker and with the deaths data, we may have missed that happening had we not been working with this data and had been paying attention to it. So what we tried to show here is that after that deaths data is published, the first day it's published, it changes quite a bit in those first 5 days. And I think the health department, their GitHub page, files are updated in place. So it's hard to see that change unless you're looking at previous commits, which we were doing every day. And so that's sort of something we wanted to show when we noticed this mistake had been made and wanted to talk about it a little bit. Next slide, please. Oh, and I'll just end the last slide. I think that's a case where sort of our work on the tracker and our reporting really went hand in hand. But the next big update that we made to our tracker was really focused around state data. And that was around June when we did our next big update. And I think there are a lot of different things that we were looking at, but this was around the time that the state was talking about reopening and what it would take to reopen businesses. And the state sort of issued these, I think it was around 7 guidelines, indicators of what would be required for a region to be able to start opening businesses back up. And so this is where we started trying to figure out, can we align our tracker to show some of these indicators in a way that's going to be helpful to people. But this created this kind of tension that's ongoing between showing the health implications of data and the political implications of this data. We had to ask ourselves if it was going to be worth changing our sources and presentation specifically to reflect these milestones, especially since we've seen that these have changed over time quite a bit. And we were cautious about reflecting the priorities of the governor as opposed to the actual health impacts that we need to be concerned with. But this is all to say, ultimately, we did make a change in our data source for testing and cases, and we switched to the state data. And the main reason for that was with these reopening indicators, any decision to reopen businesses was going to be based off of that state data. And so that was a call where we decided that that was going to be an important thing to show people if they were trying to figure out, when was the next time they can, eat at a restaurant, that sort of thing. And part of that too was also the state data was a little bit more amenable to showing a very current view, in that they weren't doing the sort of backfilling of data or adjusting data by the date of the specimen or when a test was taken. How many cases and tests happen on the same day. And while that has some benefits, I think we were having trouble with showing the changes in the cumulative data from the city. And so the fact that the state sort of intentionally presented data this way was another reason that we went to this. And next slide, please. And so that those indicators from the state and our switch to the state data ultimately sort of inspired this 4-up view of the different components of the testing data that we published in June. And even though they were sort of inspired by the Cuomo indicators, I think it turned out to be a pretty handy way to show this data. Initially, we were only showing the data in the chart on the top left of this, which is tests on top of cases. But I think a lot of people have written about the importance of looking at all these different factors in relationship to each other, including the positive rate of tests. And ProPublica in particular had a great piece about how you can't view any one of these pieces in isolation. So I think this view ended up being a helpful way to show, if you're looking at that positive rate going down, is that going down because cases went down or because testing went up, and which factors had more control over that positive rate has changed throughout the course of the pandemic, particularly around holidays when we had testing dips. So that's sort of where we ended up here. And again, there's this tension here of what we want to show about the indicators that the state is putting forward, and we resolved in this way, but that tension didn't really go away. It kind of reemerged in the fall when cases started to go back up again. Next slide, please. So in the fall, we started getting specific zip codes that had concerning increases in tests, and de Blasio was highlighting these at press conferences, and targeting interventions in that area. And that sort of came to a head in September when the city was proposing specific interventions in shutting down businesses and that sort of thing, those kinds of restrictions. And they were targeting these interventions based off of the positivity rate for each of these zip codes. And the challenge here is that we didn't really have a version of this data from the city that we could really use. There was cumulative data for zip codes, but not daily data in a way that we could say, the positivity rate for X zip code changed from, some percentage to another percentage over the course of the day, over a course of several weeks. So we were really relying on the city for this data. But what the state came in and did is say that the city has no authority to shut down businesses in this way, and they proposed their own strategy based off of address data, which you can see on the right here. And this presented a challenge from the standpoint of the tracker, in that we couldn't really talk about how the rate was changing in these areas. We were so, this was entirely dependent on this address-based data that was private, and really only the state could tell you what was going on in those areas. And effectively, the governor assumed sort of carte blanche to interpret this data and target restrictions in a way that wasn't really transparent. And this again, made it even more important to get that zip code level data of where things were changing, because that was really the only way that we had to sort of evaluate how these zones were being put together. Next slide, please. But again, really the best thing we had was that cumulative data from the city at a zip code level. And so we made some attempt to sort of distill that down again by taking the changes in the cumulative data and trying to turn that into a positive rate by zip code. And what we saw is that really didn't line up with what the mayor was, the data that the mayor was putting out at press conferences. And so we knew that we couldn't really use this data in our tracker because it would mislead people about where restrictions might fall in place next, even if it could give you a general sense of those things. The thresholds, the specific thresholds, were really important. And so this sort of became an ongoing issue that got brought up at a lot of press conferences for a while, why the city wouldn't, release more granular data, day-by-day data, time series data on zip codes. Eventually they did, which was fantastic. It sort of came in stages. One was sort of a weekly release, and then that changed to a daily release that was sort of delayed by 3 days for that to get the full accounting of data. Next slide, please. And so using that was eventually how we were able to get to this version of our zip code map. And we really wanted this for a long time. And then when the city finally started publishing this data, we were finally able to produce a map that allowed us to take a look at where that positivity rate was going up over time and where it had reached a particular threshold. So we introduced some filtering features to this map to allow you to see which zip codes fell under state restrictions, different kinds of state criteria the state had set. And this was a way that we tried to resolve that that challenge of trying to show how policy might affect you at a local level, while not also tying ourselves to repeating state data as reported by the state. Give us a way to allow readers to look at this data in a way that was personalized and where they could form the narrative that was really just based on the data itself. And we had a lot of people asking us for this kind of map for a while, so this was a helpful thing to have and an important thing to have. Next slide, please. And so I think I'm going to end by talking about the vaccine data, which is our most recent addition. We added some other things to the tracker between the map and this vaccine data, but I think the vaccine data is a good example of sort of how we really tried to simplify what we were showing, and also how that contributed to our reporting. When we started looking at, when the city started publishing vaccine data and we started trying to figure out how are we going to show this and tell our readers what's going on, we really focused in on how close are we towards herd immunity, and that felt like the most important way to show the arc of the pandemic. How close are we to being able to go outside and not worry about catching this virus, and that really required one number, which was how many New York City residents have had at least one dose of vaccine, and that was sort of our way to say, the idea being if you had one dose of the vaccine, you're likely to get your second dose at some point. But the difficulty with that number was getting that residency component. And it wasn't really part of the published city data initially. And in fact, this data is published in a Tableau dashboard, which we've been fortunate enough not to have to pull data from for a lot of the trackers so far. A lot of the sources have been a lot easier to work with than that. But this was a case where the state decided to use Tableau for this particular application. And it's normally difficult to scrape, but in this case, we got kind of lucky, or it ended up being sort of a fortunate situation because they had left the underlying data that was powering this dashboard accessible. And part of that underlying data was the residency data. So again, while it wasn't public facing, it was available in some way. And this gave us the ability to actually show this vaccination number on the tracker in a way that was going to end up being useful. And this was the beginning of our ability to say, X number of people have been vaccinated out of state, or who didn't live in the city, and that was a big part of our reporting on access to the vaccine at New York City sites to New York residents. Next slide, please. And so again, that really focused in on that one number, the share of New York City residents vaccinated, which is our top line number here. And this is different from a number that you would see on other trackers. But our thought here was that this is going to be an important indicator, and that's sort of what we wanted to focus on. And I think throughout we've tried to interpret the changes in the specifics of New York City data in a way that we could show a clear picture that would tell you something, and try to do the work of pre-processing what was available in a way that would be the most telling version of that data possible. And that's, again, gone hand in hand in our reporting. And I'm looking forward to the day that we can retire this in the same way that COVID tracking project is retiring. That's like a beautiful milestone that I'm looking forward to. But until then, we're gonna keep doing our best to keep this updated and add stuff as needed. So that's going to be it from me, and I'm looking forward to answering questions later. But until then, you can reach Anna and I at our email addresses and Twitter handles.
Thank you for all the details. That was really, really interesting. Okay, so next up we have Júlia, who's at the Washington Post now, but was at COVID Tracking Project for a while and made just like a lot of amazing graphics and data visualizations there. So excited to hear her talk about her process a bit.
Hi, everyone. I'm Júlia. I just want to start by thanking you, Betsy, for the invitation. It's great to be here and really fascinating to hear about the work of the other presenters as well. So I'm Júlia. I work as a graphics reporter at the Washington Post. Just started there in January, so it's very fresh. But I'm in the foreign desk, so I cover like a wide range of topics. but they all end up touching on coronavirus more or less because, you know, these days everything does. And before that, like Betsy said, I was at the COVID tracking project where I was co-leading the data viz team along with Peter Walker. So we were basically just creating graphics and interactive visualizations to sort of tell people what the data that we were collecting actually meant. And in past lives, I was at Reuters as a data viz developer, but you know, that was pre-pandemic, so I feel like it doesn't even count anymore. But anyway, let's get started. If you could go to the next slide, Betsy, please. Cool. So just a little bit about how I started visualizing COVID data. My experience started at the COVID tracking project back in March 2020. And I feel like I don't know, do I need to explain what the COVID tracking project is? Probably. It's a project housed at the Atlantic, and it collects and analyzes data, coronavirus data. And like it was mentioned before, the project is archiving now, but the data is still going to be available for this full year. But anyway, let's go back to this graphic here. So this was a graphic we published in March of last year. And it basically shows how the data situation in the country was back then. Not so great. So you can see how the CDC wasn't really publishing that much data. And we knew that there was much more out there. And so we started collecting this data to try and fill this gap. And this is when we first started, it hadn't even been a month yet. We were publishing much more data than they were. And obviously that's changed now, but this was the situation back then. Just to give you a little context. Next slide, yes. So this was how our spreadsheet looked like in the very beginning. And this is when we first started tracking these numbers after Alexis Madrigal, Robinson Meyer, Erin Castan, and Jeff Hammerbacher came together and started this project. And so you can see it was like a very simple, clean spreadsheet. We had no idea what was coming. So naive. Next slide, please. And it got complicated very quickly. So this is a screen cap I took last night of the spreadsheet, and you can see how, like, I don't even know what some of these things are, to be honest. And it's constantly changing. There's like subcategories of things, and then some states report like specific metrics, but don't report others. So it's a big mess, basically. And even though we were very immersed in this data, it still took us sometimes whole afternoons to understand how some of it was being created, how different states compared, what different metrics and concepts meant to them. Next slide, please. Hold on. So yeah, it didn't take too long until we realized we were going to have to do more than just provide this data. We were going to have to explain what it meant. And so we started to put more effort into this metadata part of the project, which involved naturally a lot of visualization. And that came with a lot of new challenges. So this is a graphic that I don't think ever got published. We just made for internal purposes, but basically shows how inconsistent reporting was, which I think was one of the main challenges, is still one of the main challenges. So states had different data definitions, and something that we thought was simple, like Toto tests. In early days of the pandemic, we thought it was a simple calculation. It was actually being reported in 3 different units. Next slide. And then not to mention other metrics like antibody test, which was not being reported by all of the states. And we actually found out that this metric could be reported in 9 different ways, depending on how the state was choosing to do it. Next slide. I think that was a decorative slide, so you can skip that one. So, so we started investing on daily updates and analysis that we published on Twitter. But we also started doing some more in-depth explainers, and I think this was one of the first ones. So we try to take some of the things that we were finding out while we were collecting this data and turn them into something that could serve as an explainer to the public. So this was the first big visual piece that we made. And I think if you click on it, Betsy, there's a link to the page and you can scroll through it. So this was part of the series that we did on test positivity. And this story in particular focused on explaining what this metric meant and how it could be easily misunderstood. So it was around the time that we were seeing a lot of reporting about test positivity comparisons across different states and states that sometimes were calculating this data in a totally different way. And so we made this scrolly piece to basically show how test positivity reflects the percentage of people tested who have the virus, but not necessarily the percentage of the whole population who has the virus. And it's like something so simple, but it's actually really easy to misunderstand it. So yeah, this next, oh, you're already in the next slide, cool. So in the second part of the series, we explored the different ways in which states were calculating test positivity and the formula that goes into it. And so we created this graphic that has this fictional character called Bob to exemplify how Bob would be counted differently depending on how their state reported test units. And so, for example, in a state that reports unique people tested, he would be counted as 1, whereas a state that reports specimens tested, Bob would be counted as 3 tests. So this is just sort of one example to show how inconsistent things are. Next slide, please. Just this is a parenthesis. Bob later became sort of an icon within the project, and he was transformed into emojis, socks, posters, shower curtains, and probably many more things that I don't even know about. The merch team really embraced Bob. But anyway, that's a story for another day. This is another piece we worked on at CTP, and we basically used animated GIFs to talk about this new metric that was getting really popular at the time called tests per positive, which essentially is how many tests you need to find 1 positive test. So it's basically the opposite of test positivity, right? Or percent positive, how you want to call it. You can go to the next slide, please. So yeah, we basically just compared it to positivity rate to show that sometimes what didn't seem like a big difference in test positivity, when you looked at test per positive, was actually quite significant. And that helps identifying where testing needs to be expanded, basically. That metric ended up not taking off, I don't think. But anyway, we wrote about it. Next one. And then we created these guys. That was the last story I worked on at CTP. We created these characters to represent the different test types that were available at the time and how they compared in, turnaround time and efficacy and price and all of these things. And we wanted to do this in like an approachable and more unconventional way. that would sort of like keep the readers engaged, because it can be a very boring topic depending on how you frame it. So basically I spent a whole afternoon, many afternoons reading scientific papers to try and basically create these scores on how fast, how available the test types were. And I worked with two colleagues of CTP who are epidemiologists, Ton Wang and Jessica Malati Rivera, and they helped me make sense out of the science. And that obviously made a huge difference since I don't have a background in science. So I'll bug them all the time and be like, hey, so I found this study that I think has the answer we're looking for, but does it? Like, can you double check it? Paragraph 5. Yeah, it gets really complicated really quickly, but we wanted to make this in a more digestible way. So next slide. And also this idea came from multiple conversations that I was having at the time with friends and family. And like a lot of the questions that always came up were like, you know, should I get this test or this other test? And how accurate will they be at like certain points of the infection timeline? And so we made this graphic that, you know, we found information from a scientific paper and basically shows like when each test is most effective and when the probability of detecting COVID is higher. And then the other question that kept coming up, if you go to the next slide, please, was what test type should I get? And obviously this is a simplified version of a decision tree, but we wanted to sort of try and answer that question the best way we could. And we found that, you know, after doing a lot of research and talking to people, it essentially comes down to the reason why you're getting tested. So yeah, that was a very like practical piece that we just wanted to use it as a way to answer some of the common questions people were having at the time. Next slide, please. And then in January, I joined the Washington Post, and obviously the coverage that I've done there is more tied to the news cycle. So this piece that I worked on was a piece about this isolated city in the Amazon in Brazil that was facing really severe oxygen shortages. And because of where this city is located, which is like deep into the Amazon, there are no roads that connect it to the rest of the country. And so you can only access it by air or by sea. And the trip, depending on how you choose to get there, can take almost a month sometimes, and depending on, you know, where you're coming from. But anyway, the point is this whole thing created this logistical nightmare for authorities who were basically scrambling to transport more oxygen supplies to this city. Go to the next slide. Cool. This was another piece I worked on, and it's actually about the same city, Manaus, but focus is on how the city last year was crushed by the virus. And, you know, after the whole peak passed, they thought the worst was behind them and that they had reached herd immunity because so many people got the virus there. But then in January of this year, they were crushed again by this new variant that had been circulated in the city. And so if you look on the little like locator graph here on the right, you can see how they had this like first peak, and then it got much worse later. So, and they were really not prepared for it. Cool. So like I wanted to show you guys a little bit the projects that I've done about coronavirus, and end with some like practical advice, tips that I think might be useful, that have helped me in the process of visualizing COVID data. So first one, be clear about what you're showing and what you're not showing. So, you know, include clear labels, sources, methodology when you have it. But I think that it's really important to show not only what's in your graphic, but what's not in your graphic. And, you know, be clear about that, be specific, and note those things. Number two, don't avoid an uncertainty, instead highlight it. And I think Christie is gonna expand more on this point, but this is really important. If your graphic has incomplete or missing data, or a data point that looks like an anomaly, even if you don't know it for sure, like tell your audience, you know, add a note, add an annotation, highlight something. I think it's so important to be transparent always, but especially when it comes to a topic that is already so confusing and sometimes even controversial. So number three, basically I already talked about that. You know, point out annotation, data points that are anomalies or caveats, and explain that. Number four, put the data in context. So if you're showing a specific point in time, show how that compares to other periods of time or other places. Talk about what your data is showing, but mostly why it's showing that thing. And I think a great way of doing that is adding annotations to your graphics, pointing out to like certain events that happened in that timeline. And then lastly, check your science. It's kind of ironic that I'm saying this because I think most of the people who are here probably have a science background or write about science. But even still, I think it's an important thing to know. And, you know, I didn't have a science background, so that was like essential to me. But I think even if you do, you should absolutely have other people double checking your work. You know, a colleague or an expert. You should totally look for the person who's been like studying the effect of SARS on toenails since 2003 or whatever it is that you're writing about, you know, because I'm sure that person exists. And so, yeah, check your science. Next slide, please. So those are like, oh yeah, forgot about this slide. So yeah, don't do this. This basically breaks every rule that I just said. You know, it doesn't have any labels on the X's. Basically looks like 4.9 is 0. It doesn't specify how test positivity is being calculated. It doesn't show the whole context. This is just January. So yeah, this is, I think, it's always good to show an example of what you shouldn't do. I think that sticks with people more. So just wanted to read this one. Cool, next slide. So yeah, so I left a few practical tips, but I think if you're only going to remember one thing about everything I said today, I think remember this. Because I think it's ultimately it's about having empathy. It's about putting yourself in the shoes of the reader and think about what kind of questions they might have and how you can answer them, if you can answer them, right? And once you do have an idea of how you can write about your answer, you can display your answer with visuals. Think about how the reader is going to feel like when they look at it. You know, are they going to feel confused, anxious, satisfied with your answer? And I think it's not something that you're always going to be able to predict or control, but it's so important to consider. And I think because this is a crisis that's been affecting every single person in the world, it's much easier to do that. You know, you have an idea of how it feels like to be affected by this, because you certainly are. So it's definitely easier to do this. But I think that sometimes we get so immersed in the data and in the topic as a whole that we sort of forget about this other part, the other side of the process, which is the person receiving your information, right? So yeah, that was basically all I had. I left my email here on the last slide, and I would love to answer any questions, talk about my process more, or if you want to reach out to me, happy to chat. Again, thank you so much, Betsy. Thank you everyone for coming. And yeah, I think it's time for Christie now.
Yes.
Hi. All right. I'm going to try and keep this quick because I know we're almost out of time, and you did want to have some Q&A, Betsy, right? So
Yeah.
I will try and make this as fast as I can. I just want to start off by saying that this pandemic has really just been a time when the process of science has been on public display. And this is kind of an incredible, but also maybe overwhelming opportunity for the public to really watch how science advances in real time. And so this is an opportunity for, I think, a teaching opportunity for the public. You know, as a journalist, it's not my job to teach the public science necessarily, but I do think it's my responsibility to convey the process of science in an accurate way and help people understand the context and all of that. So anyway, and I think one of the most important things that people need to understand is that, you know, when we're talking about COVID data here, is that data aren't neutral. They're subject to human biases, they're subject to all kinds of biases. There's this tendency to think that numbers are just sort of neutral, and that if you have a number, that's just the truth, and we've measured it and therefore it's true. I think the previous presentations really sort of went over some of the ways in which data sets can be incomplete. You can have things like sampling bias, measurement bias, collection. I mean, there's 100 different types of bias, right? But I think it's really important, and I think Júlia did a really nice job of explaining how important it is to offer that context to people, so that when you're presenting people, your readers or your audience with data, that they really understand the context. And it's really important that you're able to make clear what the sort of strengths and weaknesses of this particular data set is, so that, you know, and I think one of the reasons to do this is that if there's a weakness in it, and I think when Júlia was showing that thing where how the spreadsheet had changed so much throughout the pandemic, like you start with, you just have this thing and then it's like, oh, but what about, okay, now we're looking at this other measure too. But what happens to the public, if they don't understand that like this is all sort of provisional and this is what we're doing now, then as soon as things change, that becomes an opportunity for them to say, wait a second, scientists don't understand what they're talking about, they're full of crap, because now they're changing their mind. You know, there's this idea, and I think this is something that Biden has said very explicitly, that, you know, we need to just follow the science. And that sounds great, but science is a method of understanding. It's not an answer. And, you know, decision-making is going to be subject to change, as it should be. You know, I think Júlia showed how her project has evolved so much. And I think, you know, the best science-based policies will need to change too. And it's important that we sort of help the public understand that when scientists are changing their minds, this is not a sign that science is unreliable. This is science working. And we should actually, you know, praise scientists when they change their mind and when they sort of move on. And I think, you know, what ends up happening though, is if the public doesn't understand that science is provisional and that this is sort of all a way of getting towards the truth, then you end up having things, next slide, Betsy. I think the most sort of high profile example of this is, you know, about a year ago now, Tony Fauci was going out in the media and telling people, don't worry about hoarding masks. We don't need to do masks right now. And, that was not necessarily wrong at that time. That was based on the best evidence that we had there. This also gets to the idea that it's not just about, the evidence of whether masks work, but we had all these other concerns at that time too. There was a lot of concern that if the public went out and started grabbing N95 masks, that they would not be available to medical workers who really needed them. And so again, it's not just a matter of the science telling you to do mask work, does everyone need to wear them, but how does all of this stuff come together to make decisions? And so next slide, Betsy. So it wasn't too long before all of a sudden now they're saying, no, we want to have mask mandates, everyone needs to wear a mask. So if you don't understand that, our thinking changes and that evidence changes and even the situation can change on the ground, this has really, I think we've all seen examples of this where people are holding up this change as evidence that this is all a conspiracy and the scientists don't really know what they're talking about. And I think, part of that is on us as journalists to help the public understand why these things are changing, why whatever it is that we're thinking right now is the best available evidence, but also helping them sort of see where the points of uncertainty are and where things might change and the things that are maybe more subject to change. Next slide, Betsy. And this isn't just a matter of public health interventions. There was also a lot of this going on with different treatments and interventions for COVID. I think this convalescent plasma one is a really good example. Here, the data has been really kind of herky-jerky. This was something that held enormous promise early on. I think, there was just another RCT randomized controlled trial, I think just published in the last week or two, again, showing that it doesn't look so great for treating COVID. It's possible that there are contexts in which it is good, but I think as journalists, one of the things we need to do when we're presenting data like this is to really explain, that not every piece of evidence is similarly compelling, and, explain why these observational experiments and observational data maybe look really exciting, but we really need to be careful to show the shortcomings and sort of the uncertainties there, so that when you then have a larger sort of more rigorous trial that comes out saying, oh, wait, this stuff doesn't work, that the public's not saying, well, wait a second, you told us that that was a thing to do. Again, it goes back to this idea of like science not being the set in stone truth or the capital T, but being a provisional, understanding of the world as we know it today, given the available evidence. Next slide. So, science is not an answer, it's a process, and it's a process of uncertainty reduction. And I think it's really important that people understand there's sort of this notion that the public has of science as being this magic wand where it turns everything it touches to truth. And so then what happens is, and this is the mask mandate stuff as an example of this, then when scientists overturn previous beliefs or something changes, they say, oh, wait, now science, it's unreliable, we can't trust it, like everything changed. And so I think we really need to get away from this magic wand sort of theory and this magic wand idea about science, so that people aren't saying, okay, once we have a study, then we know this for certain. And so again, I think this goes back to Júlia made this point in one of her slides, that it's really important to not dismiss the uncertainty, but actually to point it out and to discuss it. Next slide. Science is not an answer, it's a process. It's a process for reducing uncertainty. It's an incremental process. And I think it's really important to really emphasize this. There is no finish line. There doesn't come a point where we say, okay, we know everything, we understand it. We always have to be open to new evidence. Science is a process, it's not an answer. It's too often held up as an answer. And I think this goes back to that idea of like, science, let the science determine the policy. Well, science can inform the policy, but there always have to be those human decisions that go into it, and that understanding that science is provisional and that you may make a science-based decision today that then changes in the future based on new evidence. Next slide. So I wanted to stop for a moment here to talk about, how should we be discussing science and science, in particular data, with the public? And I think, I've said this several times already. I won't belabor it, but really making sure that you're saying like uncertainty is a feature, not a bug. Like this is part of science, and anyone who's telling you they know something for certain, that's not science, that's something else. And this is really, I think this is important because we're at a time right now where you have all of these, fake news, disinformation. I mean, very, very concerted disinformation campaigns that are holding up things, that are absolute truths. And so to counteract that, I think one of the important steps in that process is helping people to understand that that certainty is not science, and that's something to be wary of. Explaining that knowledge is provisional, being open to new evidence, which is actually kind of a difficult thing to do. I think the more certain that we start to feel about things and the more evidence that we have, we should become more certain, right, as we have more evidence. But it can be difficult to maintain this open-mindedness, but I think it's something that we really need to try and cultivate. And I think it's something that we should cultivate as reporters too. Being aware of these cognitive biases and these things, for instance, we all want the vaccines to work and to be able to open everything up, right? And so that's what we really want to see, but we need to be sure that we're really looking at the data and looking at things with clear eyes. And then I think this other idea is just that the data aren't neutral, and that, a trial from a drug company is going to be set up a certain way to look favorable to their product. And so the vaccines are looking really great. And I think so far the real world evidence that we have on them are really great, but we need to be open to the fact that, once these things are out in the world, they may look different. And some of this may be there's new variants and things like that. So just being really careful that we're helping readers and the audience to really understand these things. So next slide. This is a story that I wrote for Scientific American. This was first published online in October, and then it was just in the January print issue. But basically, this is a story that really sort of walks readers through the data on COVID deaths. So there's this very persistent rumor that COVID death counts are inflated, that doctors are getting paid to say that people are dying of COVID when they aren't, things like this. It's really, my editor came to me with this assignment. I said, do we really need to do this? Doesn't everyone know that that's not true? Well, it turns out we do. I'm still getting trolls hitting me up about this story. But what this story really did was I tried to really explain to people there could be uncertainty about something, and yet you can also have a great degree of certainty about sort of the big picture. So what I mean by that is there's an awful lot of uncertainty about the precise number of COVID deaths that we have last week, today, next month, a year since the COVID started. That could be true. At the same time, we have a lot of certainty about the magnitude of those numbers. So we know now that we're over 500,000 deaths, right? Is it 500,133? We don't know, but we can be pretty sure that it's not 50,000. And so this story went through and sort of inventoried that evidence. How is it that we know that this is true? Next slide. And so it turns out that there are three separate lines of evidence to support this. One is case surveillance. So this is these surveillance networks where this is a reportable disease. So health departments have to report this to the CDC and all of that. We have the National Vital Statistics System. These are death certificates, and there's a very specific way that these are counted. And then you also have the excess deaths. So how many people died in a given month compared to what you would expect, based on other years and things like this. And so all three of these lines of evidence are pointing in the same direction to approximately the same magnitude. And so this is sort of explaining why, in the face of uncertainty, we can also have find some sort of grounding certainty. And I think this can be a hard thing for people to understand, but I hope that this story was sort of one way of going about that. So, really showing people how it is that we can know this, and how this is a fast changing number, right? But at the same time, by using these different lines of evidence, we can come to an answer that we can feel pretty confident about. We have like 3 minutes left, so I'll just try and really quickly go to the last slide here, which is I we're kind of out of time, so I guess I'll just stop there. But this is my contact info. I'm happy. I will talk your ear off all day about this stuff. I definitely have a lot of thoughts about how to help people go through the data, what kinds of questions to ask, things like where did the data come from, what are the strengths and weaknesses, things like that. But really quickly before I leave, I just wanted to point everyone to this NASW COVID-19 listserv. This is something that was done. I'm co-chair of the journalism committee at NASW. And so we formed this listserv as kind of a reference or a tool for people. It doesn't have a ton of traffic, but it's basically a way or place that people can post queries, ask for help. If you're looking for a data set that you can't find, this is a really good way to do it. There's a lot of sort of off list things. So someone will post a query and then people will respond to them individually. So it's not something that will get you a ton of email in your inbox, but I think it's a pretty useful tool for finding resources and sharing with other reporters. So, all right, 1 minute.
Yeah, I'm glad that I extended the time on this session because this definitely has been a packed hour and a half. Maybe we can just like, if folks want to stick around for a few minutes and do questions, but also feel no pressure to do that because I said we would end at 6. And I also just wanted to say a quick plug before folks head out that I'm going to be sending out all the videos and recaps that I'm writing later this week. And I will also send out a survey just for some feedback on the series as a whole. So look out for that in your email, fill it out if you have feedback that you want to provide, and that would be much appreciated. And then, yeah, I'll just see if we have any questions come in through the chat. But while maybe people are thinking of questions, do any of you have just like a favorite resource that you want to share or a story that you want to plug that you would recommend people look at for COVID data journalism?
I don't have anything to plug, but I would just say that the last 2 of these workshops were really informative, and it was great hearing everyone talk today. And I feel like I've learned a lot about different approaches to some of this stuff. So thanks everyone, and thanks to Betsy for organizing.
Yeah, thank you.
Yeah, thanks, Betsy. The presentations are great. Thanks, everyone.
Yeah, and someone in the chat mentioned Dr. Eric Topol, who does have great explainers on Twitter and pointers to medical articles. So I definitely second that recommendation. I will also say, since it looks like we don't have a ton of questions, yeah, Natalie Dean is also good as well. That the COVID tracking project has also been doing workshops as part of their sort of wind down process. I believe the last one is going to be tomorrow afternoon, but if you go on their website or Twitter, you can find information about that. And they'll probably be posting those recordings and stuff as well. If you want to get more into specifically federal data sources that might replace the COVID tracking project in any work or analysis that you do, since we are sadly spinning down our data collection. Yeah, well, thank you everyone for doing this. Thank you presenters, it was all super interesting. And again, just like look out for an email with the recording, with notes, and hopefully a survey that I'll put together in the next couple days. Cool.
Thank you so much, Betsy.
Yeah, thank you.
Thanks.
Yeah,
Bye.
thanks,
Everyone.
Betsy. You're always so organized. I appreciate it.
I do my best. Thank you.